What do my stroke MRI results actually mean? When you receive an MRI after a suspected stroke, it can feel overwhelming trying to understand what those images really tell your doctors. MRI scans are powerful tools that help identify if a stroke has occurred, what type it is, when it happened, and which parts of your brain are affected. They give a detailed picture of brain tissue damage, blood flow, and timing, but interpreting them can be complex. First, MRI can detect two main types of strokes. An ischemic stroke happens when a blood clot blocks a vessel, reducing blood flow and causing brain tissue to die. On MRI images, these areas often appear bright on diffusion-weighted imaging, which shows restricted water movement in damaged cells. Hemorrhagic strokes are caused by bleeding in or around the brain. Blood appears dark on certain MRI sequences that are sensitive to blood products, helping doctors see where bleeding has occurred. Timing is also crucial. MRI can tell how recent the stroke is by looking at specific features. In the first few hours, MRI shows early signs like swelling and water content changes in the brain, seen as bright spots on diffusion-weighted imaging. This indicates the infarct core, or the part of the brain that is already injured. Within the first week, MRI can reveal more defined areas of injury, swelling, and possible disruption of the blood-brain barrier. Between 1 and 3 weeks, ongoing changes like fluid leakage and swelling are visible. After 3 weeks, MRI shows long-term effects such as tissue loss or scarring. Different MRI sequences provide various insights. Diffusion-weighted imaging is the most sensitive for early ischemic strokes, highlighting areas where water movement is restricted. Apparent diffusion coefficient maps confirm these findings by showing reduced values in damaged tissue. Fluid-attenuated inversion recovery sequences highlight swelling and tissue injury, especially hours after the stroke. T2-weighted imaging shows edema and tissue damage, with hyperintense areas indicating dead or injured tissue. Gradient recalled echo or susceptibility-weighted imaging can detect blood products, with bleeding appearing dark due to the magnetic effects of blood breakdown products. Your MRI results tell a story about your brain tissue. Bright areas on diffusion-weighted imaging or flare sequences suggest regions of infarction or injury. The size and location of these areas help doctors understand how much damage has occurred and what functions might be affected. Dark areas on GRI or SWI sequences indicate bleeding or blood residue, confirming a hemorrhagic stroke. If no abnormal signals are seen, it could mean no stroke or that the stroke is very early and not yet visible on MRI. The clinical importance of these findings is significant. The volume of damaged tissue helps predict recovery chances. Larger infarcts often mean a worse outlook. MRI can distinguish between tissue that is irreversibly damaged and tissue at risk but still salvageable, known as the penumbra. This information guides treatment options like clot-busting medications or mechanical clot removal. MRI also helps rule out other causes of symptoms, such as tumors or infections. It's important to remember that MRI has limitations. It may take longer than a CT scan and might not be available immediately in emergencies. Some very early strokes might not show up on MRI right away, although diffusion-weighted imaging is highly sensitive. Interpreting MRI results requires expert radiologists and neurologists who combine imaging with your clinical symptoms for the most accurate understanding. After your MRI, discussing the results with your healthcare team is essential. They will explain what the images mean for your specific situation and how they influence your treatment plan. Your MRI findings help determine the best course of action for recovery, rehabilitation, and preventing future strokes. Always follow your doctor's advice and ask questions about your prognosis based on the MRI results. In summary, your stroke MRI results reveal whether a stroke has occurred, its type, how recent it is, and the extent of brain injury. Bright signals on specific sequences indicate damaged tissue, while dark signals can show bleeding. These images are vital for guiding treatment decisions and predicting recovery but must be understood within the context of your overall health and symptoms. Always consult your healthcare professionals to interpret your MRI and plan your next steps safely and effectively.